Hi, Posakis, Good News Planet. November is a lung cancer awareness month, and there's some concerns and fears surrounding small cell lung cancer, SCLC. We have a brave hero with us, both of you. Let's start with Montessa, who has been an advocate and survivor for 14 years with SCLC. Hi, how are you today?
Hi, Howard. Thank you for having us.
Thank you for coming here and speaking about your own personal journey here. And we have abizer gaslightwala, who is the head of U.S. Hematology and Oncology at Jazz Pharmaceuticals. Welcome as well.
Well, thank you. Thank you for having us.
I like the gaslight and the jazz together, work. That's kind of a musical tightness here. But we're going to talk about actually a very serious scenario, and 30 to 35,000 people have this concern. But maybe you'd give us a little bit of knowledge about what actually small cell lung cancer is.
Sure. Well, thanks for the question. So small cell lung cancer, often acronym called SCLC, is about 13% of all newly diagnosed lung cancer patients in the US every year. Unfortunately, the outcomes for small cell lung cancer patients are worse than the non-small cell lung cancer patients, which are the majority of diagnosed cases. Patients who have this disease do get treatment, but often they relapse after their initial response, and the disease has a fairly bad prognosis and outcome for many patients. As such, as patients learn about this disease with their families and caregivers, they often become fearful and anxious when they see some of this information online without any context.
Well, let me start with maybe a naive question. Small cell, large cell. I can understand the small and large word. How does cancer hit? Is it one area, or they hit both areas, but it's more prominent in the smaller cell? How does that work?
Yeah, it's just really a diagnosis that they use to describe the cells. Typically, when lung cancer, and Montessa can also elaborate as a cancer patient who's gone through this, but typically when they diagnose small cell lung cancer, it looks like small cells that are malignant or cancerous under a microscope, whereas the non-small cell lung look larger or different than this. So there's just a difference how they look under the microscope in terms of the diagnosis. But the cancer disease itself is very different, hence why they make the delineation and distinction.
And the difference, let me ask just one more question. And the difference is, I know you had said it's more concerning of a diagnosis. But is it different from how potentially someone has got it? What made someone get it as opposed to, say, the large cell? Did they, say, smoke more cigarettes, or did they do something that had caused this one to go more directly towards the small cells?
There are some, environmental factors and lifestyle choices that do link both to all types of lung cancer. There's some things that are associated with small cell lung cancer that are also associated with non-small cell lung, smoking being one. But there are also a lot of other environmental risk factors as well, and genetic predispositions as well. So it's hard to say that it's a one-to-one for each one of these cancer types.
Okay, thank you. And if we had all the answers, then we wouldn't have cancer. Montessa, hi, and thank you so much. Tell us a little bit about your history with this, please.
I'm sure. Yep, at the age of 28 in 2006, after two misdiagnoses, an X-ray would finally reveal a 15-centimeter mass in my chest, the size of a cantaloupe. I had a tumor the size of a cantaloupe in my chest, and it would eventually lead to a diagnosis of small cell lung cancer. And like abizer was talking about, my oncologist said, when he gave me the diagnosis, he said, it's really a stupid name. And my cousin, who was with me at the time of the diagnosis, we laughed and said, that is a stupid name. Why would it be called small cell? It used to be called oat cell. And I went home on Google Doc and did my own research and found out the prognosis was pretty poor, and that in the past 30 years, not much had changed in the research and outcomes for patients like myself. And I became involved in lung cancer advocacy groups. And then I saw the needle was moving for people diagnosed with non-small cell lung cancer. But for patients like myself, I wasn't seeing much research or many advancements. So I kept changing my anger and turned it into advocacy to be a voice for patients like myself.
Your lifestyle, if you don't mind me asking, prior, 14 years ago. So is there anything that you recollect and that you now speak on, say, and suggest for others to maybe not do, if that's not too personal of a question?
Oh, no, sure. I was a non-smoker. So I definitely was in the world of small cell lung cancer, an anomaly, an outcome, an outlier. But we have now come to know that anyone with lungs is susceptible of getting lung cancer. I was a vegetarian at the time, working out in the gym. My oncologist said it wouldn't be the first, second, third, fourth, fifth thing that the doctors would have even thought of.
Oh my God, you were living the right life. So has it been stated that, well, how about your family, the hereditary wise, genetic wise? Has anybody in the family had this concern?
Yes, my paternal grandfather did pass away of lung cancer. My maternal grandfather, people are on the fence. Some of my family says it was lung cancer. Some thought it was throat cancer. Now, they both did smoke, but of course, generational. My paternal grandfather also worked in homes, so as exposure to asbestos at those times and other environmental factors. One thing now we talk about is radon, in people's homes or buildings. So it's things to think about that we are so associated with smoking, but it goes beyond smoking.
Isn't there rayon in clothes? Why do I think that word is so?
Oh, well, rayon, but radon. So radon is an invisible gas.
Radon. Okay. I'm sorry. All right. Misunderstood.
Oh, no problem.
Abizer, I know that the Jazz Pharmaceuticals has created, and I've looked at it, and there's a lot of information on this website. Tell us a little bit about it, please.
Sure. So I think Montessa captured it really well in her own personal story and journey, that when we looked at this, we actually found that there wasn't a dedicated resource or set of resources that focused uniquely on the small cell lung cancer patient. And as we talked about, as patients get this diagnosis, they can often have this anxiety and fear. So we wanted to create an online digital hub platform that would be focused on the small cell lung cancer patient and their caregivers and the journey that they're on. And so we did this. We worked with a number of lung cancer advocacy groups to make sure we could have appropriate content. But really what the key content on this is that we actually take a number of stories like Montessa's and others of patients who have small cell lung cancer, as well as their caregivers, and really walk them through and let them tell their story, their own personal story and journey on this diagnosis and treatment path. The digital hub as well provides some resources and curated stories around how to build a patient support network, which is really important for these cancer patients, as well as tips on health and wellness every day living with this cancer, and also some considerations for treatment options as patients go through this with their caregivers.
Oh, yeah, there's a ton of information. Great job. Thank you for doing that. Montessa, how about your caregiver, carekeeper world? Were you fortunate enough to have some help here during this period of time in your life?
Oh, yes, I was. My parents live in another state, but on the weeks that I had chemo, my mom would come up. I have extended family in the area. Like I mentioned, one of my cousins who was there at my diagnosis. Another cousin who was my roommate at the time was there when they first did the x-ray. And my church family gave me rides back and forth to chemotherapy and simultaneously. I had to have chemotherapy and radiation at the same time. So I had rides from my church family, a whole support network. And that's what I would advise patients to do.
How about yourself? Do you do anything? Do you exercise more? Do you eat differently? Are there some other kinds of things that you're doing to imagine there's some good farm, things out there too to help you during this time? What's your regimen, if you don't mind me asking?
Yeah, so it's on my bucket list to exercise more. I do need to do that. But otherwise, I still go back to doing what I was doing before I get sick. And I have joy in my life from serving others and doing some volunteer work. And every now and then I will take a water aerobics or a water aqua boot camp class to get my heart rate and things up.
Well, you have an infectious smile. You're beaming. You're a happy person and so strong and so positive, and that's wonderful. And thank you for coming on. Abizer, is there any other kinds of things you'd like to share with us?
Sure. I would just ask patients that are interested in caregivers, just check out the site, www.nothingsmallabout.com.
And yourself, Abizer, let me ask you, what brought you into this field?
Sure. Ultimately, it's a passion for patients. I mean, you hear stories like Montessa, and you think about how we can make a difference for patients, and ultimately take science and all the research, great research that scientists do, and how can we help actually make a difference for patients, and education and helping them be aware of how they can actually enable and empower themselves is a critical part of that.
Okay, thank you both. Very nice to speak with you, and I look forward to meeting with you both at a later moment. We're here in New York if you need us. All right,
Thank you so
very
much for your time.
Okay, you take care. Bye-bye.
Bye-bye.